are many patients who come to us with more than 5 years, more than 8 years of married life, not getting pregnant. They have undergone many IUI cycles, many IVF cycles, and not getting pregnant. And how is it that we can help these patients? We can help them by doing an advanced semen analysis test, and this is called sperm DNA fragmentation. And we have many stories that we can share with you of patients getting pregnant after doing this simple test and undergoing simple treatment. I am Dr. Anupama Deendayal Mettler. I'm an embryologist and a gynecologist, and I'll be talking about this advanced semen analysis test today. When you look at a sperm has a head, a neck, and a tail. In the head is the DNA of the man that is going to go and fertilize the egg to produce an embryo. Due to various reasons, there can be damage that occurs to this DNA, that is, breaks occur in it, and these breaks are called fragmentation. And when the breaks increase, there is an increase in the DNA fragmentation index of this man's sperm. And this can lead to failure of treatment to get pregnant, multiple abortions, or even in the IVF lab, poor development of embryos. Why does this high DNA fragmentation occur? It could be due to lifestyle factors, either smoking, excessive alcohol consumption, being overweight, or having a high stress level. Even what you eat every day in your daily life affects the health of the sperm. Another reason could be exposure to pesticides, chemicals, radiation. Even varicocele is an extremely important reason why the DNA fragmentation could be high. I'm sure you know that exposure of the testis to high levels of heat causes, again, damage to the motility of the sperm. That is, the number of sperm that move are motile, decrease, and there is an increase in DNA fragmentation. Now, what you could do is maybe when you're trying to conceive, don't go to a sauna. When you're working on your laptop, don't put it on your lap. Or even on long journeys where you have to sit for a long time, there is a certain increase in temperature, because we see this in fact, drivers of cars where they have to sit on a seat for a long time. So maybe take breaks if you're driving a lot. Now, how can patients with a high DNA fragmentation be helped? One, there are various medications or lifestyle changes that can be done to decrease this fragmentation, or there are special processes in the lab that can be done that separate out the sperm that are damaged and not damaged, and then only the sperm that are not damaged can be used for a treatment. How is this test done? It is measured by a flow cytometer that measures 5,000 to 10,000 of the sperm of a man to check how much of the DNA is damaged, and a report is given of the level. If it is below 25%, the chance of you having a natural pregnancy, if the count and the motility is good and your partner doesn't have any other factors, is very high. But if this DNA fragmentation is above 25%, then definitely a little help is needed. And we've had many success stories. So even if it is above 25%, you do not need to worry. There are methods to help you get pregnant and have a healthy baby. Our team at Mamata Fertility Hospital wishes you all the best.